All right, so welcome everyone. I think this deep dive is going to be particularly relevant to a lot of you out there working with HIV RNA Test Guide podcast. Helping folks across the US get access to testing. We're really going to dig into some potential changes, some big ones in how the US government is thinking about and supporting HIV prevention.
Yeah, sounds like some important stuff to cover.
It really is. Our main goal here is to try and figure out what these changes, actually are in practice, and then what impact could they have. Not just in a broad sense, but specifically for the folks listening and the work they do connecting people to testing.
Makes sense. The testing landscape is so crucial. Got to stay ahead of the curve if things are shifting.
Absolutely. And to guide us through all of this, we're mainly focusing on a recent report that details a lot of these possible policy changes. Ready to dive in?
Let's do it. Break it all down.
All right. So to get us started, maybe you can give us a bit of a foundation. Like, what has the recent approach to HIV prevention looked like at the federal level? Just to set the stage for understanding these potential shifts.
Right, so it's crucial to have that context right. So if we go back to 2019, the Trump administration actually launched a pretty big initiative. The goal, very ambitious, was to completely end the HIV epidemic in the U.S. by 2030.
Wow, 2030, that's not that far off.
No, not at all. And a really interesting part of this plan, this is important to remember, is that it was very targeted. It focused resources specifically on 57 jurisdictions across the country where the need was the highest.
So kind of a data-driven approach to say, okay, where are the resources most needed and let's put them there.
Exactly, really trying to be strategic and make the biggest impact. And the report actually highlights how, although it might have initially been a bit of a surprise coming from that particular administration, the initiative ended up getting a lot of praise.
And praise is good, but I'm guessing what's even more important is whether it actually worked.
That's the key question, right? And the data actually suggests that, yeah, it was pretty successful. The report points to a substantial 30% reduction in new HIV infections among adolescents and young adults by 2022. And that's huge. Plus, around a 10% decrease in most other groups.
So it seems like focusing those resources where they were most needed was actually a good strategy.
Seems like it.
Yeah.
It really underscores how effective targeted funding and prevention strategies can be.
Yeah.
Not just throwing money at the problem, but being smart about it.
And I imagine that success wasn't just a coincidence. The initiative probably had some pretty specific areas of focus.
You're exactly right. It was very much focused on specific populations that were at higher risk. So we're talking about poor Black communities, gay and bisexual men, and transgender women. It was really about understanding the unique challenges these groups were facing and tailoring the response to meet those needs.
So really homing in on those communities where HIV was having the biggest impact makes a lot of sense. The report actually mentions something pretty interesting, too, about the level of support this initiative got. It quotes Adder RM Brett Giroir, who was involved with the previous administration, saying that the former president was wildly supportive, which is kind of surprising, given that these groups weren't exactly his typical base, right?
Yeah, that's an interesting point, and it kind of hints at the fact that maybe there's more potential for agreement on this issue across the political spectrum than we often realize. Finding common ground.
Absolutely. And it's not just about who supported it, but also what they actually did, right? The report also talks about how they used a pretty interesting tactic to try to improve access to those preventative medications like PrEP. They basically used government-held patents to negotiate better drug prices with pharmaceutical companies.
Oh yeah, that was a pretty bold move. Using the government's leverage to try and get those costs down. And, Jeremiah Johnson from PrEP for All, he even came out and said that these actions made a real difference. So it seems like there's some concrete evidence that those strategies were having a real, tangible impact on the ground, which makes the current potential shift in direction all the more significant.
Right.
Like, we're seeing things that worked, and now there's talk of moving away from them.
Yeah, I think that contrast really is what makes this so noteworthy. If these previous efforts were showing real progress, why the potential change? And according to the report, it sounds like there's some pretty big changes being considered.
Yeah, and I think what we're seeing now are discussions around potentially ending those NIH grants that were focused specifically on PrEP research, pre-exposure prophylaxis, the medication that can help prevent HIV. It's a crucial tool in the toolbox. And the report indicates that scientists involved in these research projects have already gotten notifications about possible funding cuts.
So Those working on the front lines of research are already feeling this potential shift, and it sounds like it's not just research funding that could be impacted. The Department of Health and Human Services is apparently considering a pretty major restructuring, and this could include possibly even shutting down the entire HIV prevention division at the CDC. I mean, that's big.
Oh, that would be absolutely massive. And they're even talking about maybe moving some of those activities to a completely different agency.
So we're not just talking about tweaking things around the edges here. This sounds like a potential fundamental change in how the government approaches HIV prevention.
It's a pretty significant shakeup for sure.
So let's dig into that a bit. If this were to happen, what would that actually mean for the work that the CDC does now? Remind us what their current role is in HIV prevention.
Right, so thinking about the CDC's role, it's really broad. They provide a ton of funding to state and territorial health departments. And that funding supports a whole bunch of stuff. We're talking about detecting and responding to new HIV cases, implementing prevention programs, supporting syringe exchange programs, which are so important for harm reduction, expanding HIV testing in emergency rooms, and just broadly running education and awareness campaigns. I mean, the scope is huge.
Yeah, it really does sound like they're involved in a lot of different aspects.
Oh, absolutely. And when you think about the fact that about 1 in 4 new HIV diagnoses are made with agency funds, it really hits home how critical their role is.
And we're talking about the agency, the CDC, right?
Yep, the CDC.
Okay, that's huge. 1 in 4. I mean, that really puts it in perspective how much of an impact they have. And if that whole system were to change, if that infrastructure were to be significantly altered, I mean, what are the potential ripple effects? What could that actually look like?
Well, the report includes some pretty stark warnings from some real experts in the field. Dr. Julia Marcus at Harvard Medical School. She's actually lost multiple research grants already because of this. And she raises a very concerning point. She basically warns about the potential for a resurgence of HIV if this prevention infrastructure is allowed to just collapse.
A resurgence? Wow, that's a pretty dire prediction.
It is. And the fact that a federal official, speaking anonymously of course, has actually confirmed that these plans, while not 100% guaranteed to happen, are being very seriously discussed. It means these are real possibilities. These aren't just rumors or speculation. And that should concern all of us, especially those working directly in HIV prevention and testing.
And it's not just the U.S. either, right? The report also mentions that there have already been impacts on HIV prevention work happening globally, even on critical clinical trials, because of cuts to funding at USAID. I mean, that's the U.S. Agency for International Development.
Absolutely. And those kinds of setbacks on the global stage, those can have really long-term consequences. We're talking about potentially slowing down progress towards a cure or a vaccine, not just in the U.S., but worldwide.
It's really a ripple effect, isn't it?
Yeah, for sure. And we look closer at the types of NIH grant projects that have reportedly been canceled or are on the chopping block. It's pretty revealing. We're talking about research that's really focused on some of the most vulnerable and marginalized communities. Studies on transgender people, HIV in children, the role of substance use in transmission.
And what about those efforts to increase the use of PET among underserved groups like Black women? Those were specifically targeted in the previous initiative, weren't they?
Right, those were key priorities, and now that research is in jeopardy. And a quote that really stood out to me from Jeremiah Johnson, again from PrEP for All, was that it doesn't seem like the current administration is motivated by prior accomplishments. And that, to me, suggests a potential disconnect, right? Like we're moving away from things that were demonstrably working without a really clear rationale.
Yeah, that's a concerning observation. So, okay, if we're talking about moving away from the CDC's role, what's the alternative being proposed? What's the plan?
So the report outlines a tentative plan to shift some of those programs that are currently under the CDC over to the Health Resources and Services Administration, which is also known as HRSA.
Okay, so HRSA would be taking on some of those responsibilities. And what does HRSA usually focus on? Like, what's their main role in the health landscape right now?
So they already play a pretty big role in HIV work. They provide funding to a lot of those same state and local health departments, as well as community-based organizations that provide a whole range of HIV services. And the big one that they're known for is the Ryan White program.
Oh yeah, I've heard of that. And what's the main focus of the Ryan White program?
So Ryan White is really all about providing care and treatment for folks who are already living with HIV, making sure they have access to medication, support services, all of that.
Okay, so very much focused on the care side of things.
Exactly.
So if those prevention programs were to shift from the CDC to HRSA, I imagine there are some mixed opinions about whether that's a good idea or not.
Oh, yeah, for sure. I mean, change always brings uncertainty, right?
Okay.
And the report highlights some of those differing perspectives. For example, David C. Harvey, who's from the National Coalition of STD Directors, he seems to see some potential positives. He talks about the possibility for more efficiencies in biomedical prevention if things were under HRSA. So maybe a bit more streamlined, a bit less bureaucratic.
That's interesting. So there's potential to maybe even make things run a little smoother in some ways, but I imagine there are also concerns about what could be lost in this kind of a shift.
Absolutely. There are definitely some big concerns being raised. Mitchell Warren from AVSE, he makes a really crucial point, which is that while the Ryan White program is fantastic and so important for people living with HIV, the core mission of HRSA is not prevention. Their focus is on care and treatment. And he really stresses that the CDC's dedicated focus on prevention is critical if we actually want to continue driving down the number of new HIV infections.
That makes a lot of sense because even though care and prevention are connected, they are distinct areas, right?
Absolutely. They require different expertise, different approaches, different strategies. You can't just treat your way out of an epidemic. You have to prevent new infections from happening in the first place.
Absolutely. And I think that's where the concerns about HRSA's capacity and expertise come in.
Right. Because there are worries about whether they have the experience and the infrastructure to effectively take on this really big and complex task of managing public health prevention programs on this kind of scale. And the report quotes Michael Rapal from the AIDS Institute, and he brings up some important points about HRSA's potential lack of experience in actually administering these kinds of large-scale prevention programs. They're not really set up to do that kind of work right now.
That makes sense. I mean, if it's not what you've been doing, there's going to be a learning curve.
Exactly. And he also highlights something else that's really important to consider, which is the potential loss of all that institutional knowledge that the CDC has built up over decades. You know, the relationships, the expertise, the understanding of how these programs actually work on the ground. It's a lot to lose.
Yeah, and those connections that they've built with state and local health departments, especially in those high-risk jurisdictions, that's not something you can just build overnight.
Not at all. And if those relationships are disrupted, it could have a real impact on the effectiveness of prevention efforts.
It really could. And throughout all of this, I think it's really important to remember who's most affected by HIV, right? And the report brings us back to that point by reminding us that the majority of new HIV infections continue to be among gay and bisexual men and transgender women.
It's a stark reminder that this isn't just an abstract policy discussion. It has real-world consequences for people's lives. And the report quotes Dr. Chris Byer from the Duke Global Health Institute, who really underscores the need to make sure prevention efforts are laser-focused on these communities. You know, not a one-size-fits-all approach, but really understanding and responding to the specific needs of those who are most at risk.
And I think that ties into those concerns about the potential cuts to research on stigma and prevention strategies within those LGBTQ plus communities.
Right, because stigma is a huge barrier to accessing prevention and care. If we don't understand and address that, then our efforts are going to be less effective.
And there's also this debate kind of bubbling under the surface about how much funding should actually be dedicated to HIV research. The report mentions that some Republican lawmakers are suggesting that the funding should be more closely tied to the current national prevalence of HIV. Basically, the argument is, if there are fewer cases, then we need less research funding.
And I think that raises a really important question about how we view and prioritize scientific research.
And I'm guessing there's a counter-argument to that.
There is. Dr. Byer, who we mentioned earlier, makes the point that we can't just focus on the current situation. We need to be thinking long-term. And that means continuing to invest heavily in research aimed at finding a vaccine and a cure. He argues that cutting back on research now could actually set us back significantly in the long run.
So even if we're making progress now, we can't lose sight of that ultimate goal of finding a cure.
Exactly. And a cure would be a game changer, not just for the U.S., but for the entire world.
So looking ahead, it sounds like we're in a bit of a period of uncertainty. We don't know exactly what's going to happen, but it looks like some significant changes are being considered. And if those changes do happen, what does that mean for public health organizations? What does that mean for the folks listening who are working on the ground?
It's definitely time for adaptation. We're going to have to be flexible and figure out how to work within whatever new systems emerge.
And are there any ideas being floated about how to adapt, how to potentially fill the gaps if that federal funding is reduced or redirected?
Yeah, there are some interesting possibilities emerging. The report talks about a potential increase in direct purchasing agreements between pharmaceutical companies and individual states or large nonprofits. That would be a way to try and secure PEP and other preventative medications, even if federal support changes.
So, kind of bypassing the federal government and going straight to the source.
In a way, yeah. And there's also talk about the need for new kinds of partnerships, maybe between different stakeholders, maybe between different sectors, thinking creatively about how to pool resources and expertise to make sure prevention work continues, even if the landscape looks different.
So, kind of a call to action to get innovative and proactive in the face of uncertainty.
Exactly. And that ties into a quote that I thought was really powerful from Mitchell Warren. He urges folks to snap out of any paralysis or any disbelief or shock, and we've really got to look at what needs to be built in the future. Like, don't get stuck in the fear or the frustration, but start thinking about solutions.
A really important message. So, kind of a call to action for all of us. Don't just sit back and wait to see what happens, but get involved and start shaping the future of prevention.
And he also had another point that I thought was worth highlighting, which is a bit of a warning, really. He cautions against letting the narrative around these changes be controlled by people who don't really understand the science, who don't understand healthcare delivery, who don't understand the complexities of research or foreign assistance. And I think that's a crucial point, right? We need to make sure that the people who are making these decisions, the people who are shaping the conversation, are actually informed.
So making sure those voices with expertise are being heard.
Exactly. And those voices include all of you out there listening who are working in the field, who are on the front lines.
So to bring it all together, we've talked about a lot today. We started by looking back at that initiative from the Trump administration, which seemed to be having a real impact on HIV prevention efforts. And then we shifted to looking at this potential move in a very different direction.
Right, and it really is a stark contrast.
Yeah.
And if these changes are implemented, it's going to have major implications, not just at the national level, but for all those communities, especially those most vulnerable communities that are disproportionately impacted by HIV.
And for all of you listening out there, those of you who are so deeply connected to the really vital work of HIV testing across the country, I think this raises some really important questions that are worth thinking about. Given these potential shifts in how prevention is approached, how might the role of testing evolve? How might access to testing be impacted?
Those are great questions.
Yeah, and how can we make sure that people continue to have access to the information they need? How can we make sure they're empowered to take the steps they need to protect themselves, regardless of what happens at the federal level?
It's really about thinking about the future of HIV prevention and testing in a holistic way. How do these pieces fit together?
Exactly. And it's about thinking about how these big policy discussions happening way up there in Washington could actually ripple down and impact the work you're doing every day in your communities.
It's about staying informed, staying engaged, and advocating for the resources and support that are needed to continue the fight against HIV.
And remembering that we all have a role to play in this.
Absolutely.
All right, well, on that note, I think that's a good place to wrap up for today. Thank you so much for joining us for this deep dive. And to everyone listening, thank you for the work you do, and we'll see you next time.
Thanks for having me. It's been a great conversation.